So today we will be talking about the in detail about diuretics in antihypertensive drugs classification. I mentioned diuretics there also because diuretics is common question for first year and second year both. In first year you will be studying on the topic antihypertensive drugs classification and their mechanism of action, usage, adverse effect in CVS block. And in second year you will be studying in renal and electrolyte block pharmacology under the headings diuretics. So classification here I will classify as needed in the second year these diuretics, and for first year please follow the classification uh, according to the classification I mentioned in antihypertensive drugs, but their mechanism of actions, usage, adverse effect, contraindications and questions like short note or theory, short note or MCQs viva will be common for both first year and second year. So let's start. And if you are studying for second year, please refer this classification that I am going to explain, and for first year please refer classification according to the antihypertensive drugs. Diuretics. Diuretics. Here, as name suggests, diuresis. Diuresis means increased increased amount of urinary excretion, increased amount of urinary volume or amount of urinary excretion, and those drugs that causes these diuresis are called diuretics. In simple words, diuretics. Since there is, besides other electrolytes and fluid loss, there is net loss of sodium and water, salt and water, hence also known as these drugs also known as natriuretics. Sorry. From the general chemistry, you know this natrium. Sodium is also known as in Latin language natrium, and from that natrium the term is derived natriuretic. So this is also known as natriuretics. Now, okay, now we will see the classification, and this classification I mention according to the classification according to classification on the basis of efficacy, on the basis of efficacy on the basis of efficacy of these drugs. Which drug are how much efficacious? So this will be classified as, at first, high ceiling diuretics. High ceiling diuretics. These are also known as loop Diuretics. Why called so? I will explain in mechanism of action. Loop diuretics. Loop diuretics. Examples will be hydrochloro. Sorry. Examples will be furosemide, furosemide or furosemide. Both are correct spelling. Whatever you like, you can write furosemide and furosemide. Then torasemide, torasemide, bumetanide, bumetanide. Then there will be ethacrynic acid, ethacrynic acid and organomercurials. Remember these two drugs, these two are these two are of only historical value, not used currently. At the beginning, these drugs were first identified, and at that time these were used. But now, because of these better congeners now identified and made, these drugs are not used currently. Not used currently. So if you don't know these two examples, don't worry. If you don't know, you can skip these two examples. But remember above three examples. Among them, this furosemide is again very important. You might be asked to write short note on this furosemide. Next will be high selling loop diuretics. Next will be, and also I will mention here brief mechanism of action. What they will do inhibit sodium potassium 2 chloride synthoter 2 chloride transporter at transporter co transport at thick ascending limb loop of Henle. I will explain in detail later in mechanism of action. And next will be thiazides or medium efficacy. Medium efficacy diuretics, medium efficacy. Here again will be two types. One will be thiazides. Thiazides examples: hydrochloro hydrochlorothiazide, hydroflumethiazide, hydroflumethiazide and benzethiazide. Benzethiazide. Next will be thiazide like thiazide lab. Examples will be chlor chlorthalidone, metolazone, gipamide, indapamide, and next will be clopamide. And one more category, and these medium efficacy drugs mechanism of action will be inhibit sodium chloride symport or co-transporter symport at distal convoluted tubule early DCT. And next is medium efficacy. Sorry, these are medium efficacy. These will be weak efficacy or adjunctive diuretics, weak or adjunctive diuretics. Here I will be numbering. First will be carbonic anhydrase inhibitors. Examples: acetazolamide, and its some other congeners like dorzolamide, brinzolamide. But the congeners and these, including this, are used in mainly glaucoma. Acetazolamide. Next will be osmotic diuretics. Examples: mannitol, isosorbide, and glycerol, and again next will be number 3. In this number 3, again there will be two subcategory: potassium sparing diuretics. Here again will be two subcategories. Number A will be aldosterone antagonist. Aldosterone antagonist. Examples you know from antihypertensive drugs classification: spironolactone, and eplerenone. B, remember, these are renal epithelial sodium channel ENaC channel blockers. Examples: amiloride and triamterene. Okay. For some of these drugs, I mentioned the mnemonics in antihypertensive drugs. For some drugs, remember here these osmotic diuretics. For osmotic diuretics, remember the mnemonics. If you if you love to go the gym, so remember the gym, that is gym where you go to build your body for exercise, gym. And to go gym you wear gym outfit, gym outfit, so remember gym outfit. From behind forward, O for osmotic diuretics, M mannitol, I for isosorbide, G for glycerol. Here also remember these renal epithelium sodium channel blockers as rat. R will stand for renal epithelial sodium channel blockers, A for amiloride, T for triamterene. And for this elevation antagonist I mentioned also in antihypertensive drugs classification. Remember at C. A for elevation antagonist as spironolactone, and E will stand for eplerenone. And here these thiazides, remember at thiazides at, if you are a student, a BDS student, you will be knowing that there is, for restoration there is called something as GIC cement or GIC, glass ionomer cement. So remember here GIC cement, here. So again last T remember as thiazide like. Then examples will be from behind again, Me for metolazone, uh, 1C for culpamide and 1C for chlorthalidone, I for indapamide, and this XI for gipamide. Remember GIC cement. And for again here these high selling diuretics, remember at H for TB, H high selling diuretics, F furosemide, T toracemide, B bumetanide, E ethacranic acid. Again I mention these ethacranic acid and organomercurials. If you don't know, no problem. Remember above first three examples. Now why I mentioned this classification in detail, because from this classification in KU BDS 2024, KU BDS 2024 university examination, 3 MCQs were asked from this classification out of 30 MCQ. 3 MCQs, only 3 MCQs. Remember how important this topic is. 3 MCQs. What were they? One MCQ was from these thiazides. What question were? The mechanism of action of hydrochlorothiazide or hydrochlorothiazide, like hydrochlorothiazide inhibit or block which transporter? So answer will be sodium chloride symphoter. Sodium chloride symphoter. These were MCQ. One MCQ asked in Kathmandu University BDS 2024 University examination. Next question was from these mechanism of actions of these classification K plus sparing diuretics. Questions were which of the following is the, also mentioned here, second year. These MCQs were asked in second year BDS University examination 2024 second year, and the question are common for first year also. These questions are frequently asked in first year also. Which of the following is the K plus or potassium sparing diuretics? There were diuretic. There were 4 options. Among them, correct option was this eplerenone. The correct option was eplerenone. Again, one more example from the usage of this weak or adjunctive diuretics. Question where drug used in mountain sickness. If you are fond of climbing the mountain hills, you must be knowing that in that case you will be taking the prophylaxis or later prophylaxis of this carbonic anhydrase inhibitors, that is acetazolamide. Drug used in mountain sickness. There were 4 options again, and the correct options one option was this acetazolamide. Why I am mentioning these MCQs? Because I want to make sure that these topics or classifications are how much important for MCQs and short notes also. MCQs, long questions, short notes, MCQs and theory viva also. Everywhere you will be asked these questions. So these were the classifications of the diuretics. Now I will talking in detail about the mechanism of action.